Welcome, everyone, and thank you for joining today's webinar. I'm Jim Huffman with the Integrated Benefits Institute, and I'll be moderating today's discussion. I'm joined by my teammate, Dr. Sera-Leigh Ghouralal, who led this research project and will share key findings. We're very excited to be joined today by Tammy Fennessy, who is responsible for benefits at Dick's Sporting Goods. Welcome, Tammy. Could you share a little bit about your role at Dick's?
Yes, absolutely. Thank you, Jim. So yeah, I'm the Director of Benefits at Dick's Sporting Goods and have about 2 decades worth of benefit experience leading employee benefit programs. Thanks for having me.
Fantastic. Thank you for joining. Now, we have 1 hour scheduled for today's session. We are recording, and we will share the link of the recording as well as all of Sarah's slides to those who registered for the webinar. Please take advantage of the Q&A feature and submit your questions. We've blocked time at the end of for Q&A, but please don't hesitate to drop a question at any time. Our topic today is innovative benefit design for women's health. Many employers have implemented benefit programs over the past few years, and questions are being asked. Is it working? Are these programs reaching the intended audience? Are they engaging and leading to the impact we expected? Sera-Leigh's research identified some key findings, and we'll hear directly from Tammy on her experiences leading benefit programs at a large organization. I'm confident you'll find today's discussion to be very informative. So let's get started. Sera-Leigh, I'll turn it over to you.
Thank you, Jim. Welcome, everyone, and thank you for joining us today. I'm going to dive right into our data. So for our research objectives, we had a twofold approach. First, we're evaluating how comprehensive women's health programs from maternity and mental health to reproductive and menopausal care influence workplace metrics like retention, satisfaction, and productivity. Secondly, we wanted to look at how digital solutions, specifically measuring their accessibility, user experience, and effectiveness, how they work in delivering health outcomes. To do this, we completed a comprehensive quantitative survey examining how employers deliver women's health benefits and their impact in the workplace. We surveyed 1,001 female employees to get this information. The study focused on 3 key areas: benefit awareness and communication effectiveness, utilization patterns, and outcomes, and the role these programs play in employee satisfaction, productivity, and retention. Let's take a look at the demographic patterns in our samples. Healthcare led the industries at 19%, while education and retail came in at 11%. You can see here. Most users were earning between 50 and 75K annually, and representing 25% of our responses, while 100 to 150K bracket represented 19% of our respondent bracket. Age-wise, we see the highest response from 30 to 39 years old and 40 to 49 years old following after that. As you can see, we had most of responses from the South and the Midwest. So let's get into what our data told us. The data shows overwhelming support for women's health benefits in the workplace. 89% of our respondents reported that these benefits boost workplace satisfaction, while 85% say they help with talent attraction and retention. An impressive 90% rated their employer's benefits as excellent or good. Looking at usage patterns, we see preventive care usage leads at 63%, followed by mental health support at 54%. And then digital health solutions at 50%. Please note that these were a select all but applied, and so that's why they don't total to 100%. So we also wanted to look at the impact divide between benefit users and benefit non-users. So the previous slide was all employees, whether they used it or didn't use it. And then we broke that out into users and non-users. The data tells us an interesting story. While there is broad agreement on the value of these benefits, actual users, shown in blue over here and over here, consistently report stronger positive sentiment. This pattern holds true across all metrics, from workplace environment and attitude to job satisfaction. Notably, benefit users also express stronger agreement that these programs have positive impacts on talent attraction and retention. It suggests firsthand experience of these benefits really reinforce their perceived value in the workplace. However, despite these positive perceptions, there are barriers to utilization that were identified by our respondents. And the three most common ones were time constraints, cost of care, and difficulty scheduling appointments. Now, I want to point out here that time constraints means their own personal time, finding time to do these things or use these benefits. While difficulty scheduling appointments is actually availability of appointments, being delayed until 6 months, not having that availability to actually schedule appointments. So we wanted to break down the usage patterns of these benefits by demographics, and that revealed some really good trends. The 30 to 39 age group led in overall benefit utilization, with younger employees, 18 to 39, favoring mental health services, while those over 40 showed higher engagement in preventive care and age-specific benefits like menopause support. Industry-wise, we see stronger engagement in tech, finance, and healthcare sectors, and we also see more frequent benefit use among higher earners, particularly in the 100 to 150K per year bracket. We also looked at satisfaction with benefits communication, and we see clear demographic patterns here as well. Older employees and higher income brackets report higher satisfaction levels. In contrast, younger workers and those in lower income brackets reported less satisfaction or more dissatisfaction. By industry, healthcare and professional services led in satisfaction, while retail and tech showed notable dissatisfaction rates. Income remains a key factor, with lower income groups showing the highest dissatisfaction and high, despite overall mixed responses. Again, older participants and those in higher income brackets tend to proactively seek out benefit information. This is also seen in professional services and healthcare industries compared to other industries in our sample. Conversely, younger participants relied on more passive communication, such as onboarding sessions, which can lead to lower utilization. And this is also seen more frequently in retail and low-income earners.
Hey, Sarah, let me jump in with a question there, because I'm interested in the communications. So the younger, under 40, and were, I think you said they were less satisfied than the 40 and over. Was that a function of how the employer was communicating through more traditional means?
Yeah, so when we go back to satisfaction here, it was communication satisfaction by age group. So that the way that the employer communicated or how much they communicated, the younger generation was less satisfied than the older generation.
So Tammy, you had mentioned earlier when we were chatting about your benefit guide that you did for this season. That's a traditional way of communicating. I wonder how that resonated with your workforce.
I think they were very pleased to actually have something again that was tangible that they could bring home to their families or have as a reference. I think that's the hardest part about benefit programming is so many employers have so many different types of solutions and programs we're trying to push out that it just gets lost in translation, and people they're busier than they probably ever have been in their lifetimes, and trying to like juggle navigating through benefits just is really tough. I know one of the things that really resonated with me that you just pointed out as well, Sera-Leigh, is like the higher wage earners, using the benefits so much more. And I think it's very interesting because I think from my lens, I've always built out equitable benefit strategies and programs. And we have to make these things more accessible to lower income populations. We've got to break down that communication barrier so that they can understand what actually is in their hands. And I think that is what kind of promotes this, business case around the digital types of solutions, and being able to, really put it in, in a way that's easy for them to access anytime they want to, 24/7, 365, because life continues. And
Exactly, yeah. And then you see, like in the slide that I just finished talking about, we looked at how they acquire their information, whether they're actively seeking it out. The older participants in our survey did that more than our younger participants. Our younger participants kind of just looked at their onboarding sessions or relied on more passive communication than actively seeking out what is in their benefits.
And older is relative, right? Over 40 is.
Over 40, yeah. That's how I split it, yeah.
Let's call it mid-career.
Right.
It works.
Right. Any other questions?
No, thank you.
Sure. So we also looked at benefit usage by method of learning. And we found that ongoing communication and proactive information seeking behaviors were, of course, associated with prior usage of most benefits. It wasn't very surprising. Those participants who received passive communication had slightly lower usage. Lower income participants who received continuous communication were more likely to use maternity and preventive care benefits, while higher income participants utilized a broader range of benefits regardless of their information source. So it really shows how you have to tailor how you communicate your benefits based on the demographic of your employees. We also asked our sample about health conditions. So let's look at health conditions across our survey population. 41% reported depression and anxiety, 16% reported hypertension, and 13% reported diabetes. A notable 36% reported none of the listed conditions. Depression and anxiety emerged as the most common condition among all demographics, peaking at 47% for ages 41 to 50. Age patterns showed increasing hypertension and diabetes in the 41 to 64 age range. Looking at industry, healthcare and industrial sectors show higher hypertension rates around 21 to 22%. And income correlated interestingly with conditions. Depression and anxiety peaked in middle income groups, while reproductive health issues increased with income. Notably, though, high income respondents are more likely to report no health conditions, which lines up with them more likely to be using their benefits for preventive care.
Hey, Tammy, let me ask you, I think Dick's would fall into the retail industry. Do these numbers surprise you from what you can see in the retail sector?
No, they do not. And I think it definitely lends to how we really have to bake in the mental health and behavioral health components into pretty much everything that we're doing. Make it easy and have it as part of the program. And I think a lot of vendors are starting to accept that. Like when you're talking about, like fertility assistance and baking in patient care advocates, and layering in programs for, just to be there when they need them. But the statistics do not surprise me, except for I would in my realm, I'm seeing hypertension kind of jump out more, actually quite a bit more than diabetes.
Wow. Yeah.
And I imagine the workforce at Dick's is pretty broad. I mean, I've been in plenty of the stores, so I can see the retail folks, but you've got office folks, you've got warehouse, distribution.
Absolutely.
A real cross section.
Yeah, absolutely. Yeah, we've got our corporate population. We've got 5 distribution centers, and we've got, stores in almost every state in the United States. So it's definitely, very, very diverse, and hits all four quadrants of the United States. But I think, the statistics from like a health perspective seem to be relatively consistent. Honestly, pretty much across the board. And I think we're seeing still fallout From the pandemic, I think, people have actually adopted new routines that may not be as healthy. And we're definitely seeing that, the uptick in chronic conditions and people needing higher levels of support, and especially increased mental health.
Wow.
Hey, Sera-Leigh, a question just came in the Q&A. Let me raise it because I think it's relevant to this slide. Question is, did you ask about migraines? The migraine prevalence is quite high in women, especially 30 to 39 years of age.
We did not include migraines in this. We did include musculoskeletal disorders, but not migraines in particular. We are looking to do a study on migraines in the upcoming years, so definitely stay tuned for that.
Great, thank you.
All right, so we looked at productivity, presenteeism, and absenteeism in relation to everything that I just talked about. And we found that most respondents reported missing an average of 1 to 2 workdays in the past 12 months, followed closely by 3 to 5 workdays. The main reasons that these women cited for missing their days was acute illness or family and personal responsibilities like caregiving. Most respondents reported working while feeling unwell, primarily due to financial necessity or workload concerns. And that's where we get that presenteeism coming in. So we ran some regression analysis to understand how using benefits can impact absenteeism and productivity. And we found that all benefit types that were used were associated with fewer missed workdays. But mental health support has the strongest correlation with reduced absenteeism, followed by using reproductive health benefits and using maternity care benefits. And all of this was while controlling for factors such as age, income, state, and industry. So there is a huge case here to show how much mental health benefits really support women in the workplace. It was a very strong correlation with fewer missed workdays here. Now, I'd like to reiterate that all of the benefits that we asked about did have some sort of association with the reduced workdays, but mental health benefits really stood out.
I would like to chime in here as well, just because, and again, I think it just drives home the fact that with mental health being up at the top, when you look down the scale, every single one of those can impact someone's mental health. Yeah, so it is a snowball effect that happens. Yeah, so I mean, if you're looking at each of these, I think it's just very important to not get into a silo and say you can solve everything through mental health. These are all feeding mechanisms.
Absolutely. And I think that speaks to all of them having some impact on work days, but mental health being the most impactful. And it's right, everything here kind of affects mental health in some way or the other.
Yeah, whether there's a barrier to accessing or just it not being offered at all, or finding care, which, like when I look at like menopause, for instance, you have a smaller grouping of, of women in your previous slide that are actually accessing these benefits. Yeah. But the satisfaction rate when they do is off the charts.
Exactly.
And it's very, once you open up that access, because it's very difficult to find unless you actually have a benefit that's pushing it.
I agree. And I didn't include the slide here, but in the barriers for menopause was really the only one where the top barrier was lack of available services.
Yeah, we definitely have found that. I know you probably have seen this too. Most gynecologists were never trained in menopause. So it is pretty important to find, to work with a solution, whether I know MIDI's a big one right now. There's definitely others that are out there, but, they're really leaning into this space in a very positive way and helping to employers find the right care for their people.
I was so excited when Sera shared these results early in the process, because to me, it really is a proof point that benefit leaders, consultants, suppliers, everybody in this business can really look at. And Sarah's been great to remind me that correlation is not causation. So I'm not drawing too much attribution to this, but I think for those who have been asking the questions over the last few years, are these programs working? Are they reaching people? Are they achieving what we want them to do, which is to help people to be successful and focused on their work? I think this is a good evidence point, a good directional evidence of that they are working. And Tammy, to your point, it's a puzzle. It's not just if, pick one that you don't offer today and you're going to see this type of result. It's the coordination, it's the communication, it's the ease of access. But this is so exciting to see this statistical analysis that really supports these programs do work when we offer them to people and they know how to get to them.
Yep. All right. Continuing. So we also looked at digital health and absenteeism, and we found that digital health solutions played a role in reducing absenteeism, particularly for those satisfied with the services. Dissatisfaction with the digital health services, however, correlated with higher absenteeism, especially among lower income participants. These findings really underscore the importance of accessible, affordable, and user-friendly digital health solutions in reducing absenteeism. Because again, you can have a plethora of digital health solutions, but if it's not resonating with certain demographics in your population, it's not going to work. And that's what we found in our data here among these women.
I'll just throw out one quick factoid, which was fun. In my past, I rolled out OVIA benefits to our population, and they had this diaper tracker, which ended up being like the #1 thing used by our population, which was so interesting to me. But it was, just people really got into having the ability to track how many diapers they were changing a day.
It's easy to forget that when you're sleep deprived.
I count steps, not diapers.
We also looked at the impact of health conditions on presenteeism and absenteeism. So let's focus on presenteeism here. Across all health conditions, individuals go to work unwell more frequently, averaging around 3.5 days per year compared to about 3 days per year for those without conditions. We see that COPD, autoimmune diseases, and reproductive health have the strongest impact on presenteeism. And we also saw that across all conditions, employees with chronic health issues consistently experience more presenteeism than those without. Now let's look at the same conditions with absenteeism. Those with chronic health conditions miss more days of work on average. And conditions such as cancer, COPD, and autoimmune disorders resulted in around 3 missed days on average, compared to missing around 2 days across all categories for those without. And like I mentioned, we see this regardless of condition, that there is just more absenteeism and presenteeism for those managing or dealing with these health conditions than those without. So I presented a lot of data to you, and before we get into our Q&A and discussion, let's just kind of look at 3 areas that our data highlighted in some sort of a quick summary here. We looked at benefit utilization, employee perception, and overall impact. So first, in terms of benefit utilization, preventive care is the most frequently used benefit, followed by mental health support, and employees aged 30 to 39 showed the highest utilization overall, with industries like healthcare and tech seeing the most engagement as well. Higher income employees also tended to use benefits more frequently. We also saw that there were barriers such as cost, time constraints, and lack of awareness, limiting greater usage. Moving on to perceptions, we saw that 89% of employees agreed that their benefits really influenced positive workplace satisfaction, and 85% believed that they helped with attraction and retention, while 90% thought that the benefits offered by their employer were good or excellent. However, only about 1/3 of the women we surveyed actively seeked out information on their benefits, and over 50% were asking for clearer communication and more frequent updates. Finally, let's talk about impact. Depression and anxiety have the strongest impact on productivity, with 41% of employees being affected. Mental health benefits lead to the biggest reduction in absenteeism, followed closely by reproductive health. However, presenteeism is still a significant issue, with over 70% of employees continuing to work while feeling unwell. The data paints a clear picture. Employers recognize the value of benefits and understand how they can contribute to job satisfaction and retention in the workplace. But there remains gaps in communication and accessibility, which holds back the full potential. Mental health support, preventive care, and reproductive health benefits in particular are making strides in reducing absenteeism and presenteeism among women in the workforce. But we do have to address the barriers and the communication so that we see a better outcome from these benefits for women in the workplace.
Fantastic. Sera-Leigh, we've had a couple of questions start to come in, so let me run through those and just remind everybody, please, if you have a question or a comment, drop it into the Q&A and we've got plenty of time now to run through these. First question that came in, may I ask how you measured presenteeism?
So we asked in our survey, how many days in the past 12 months did you go to work while feeling unwell due to, and we listed the health condition. And they answered never, rarely, sometimes, often, always.
Next question, was there an association between digital health usage and income?
I will have to go back in the data and I can always send you, if you put your email in there, I will send you if we did find.
Great.
Yeah, my gut would tell me that millennials and below probably access it more, but that's at least that's what I've seen in my data.
Sera-Leigh, were you able to determine what percentage of employees had undergone preventive screenings in the past year?
No, we did not ask that question. We asked in the past 12 months, what percentage of our sample utilized their preventive care benefits, but not particularly screening.
Okay. And then our last question that's come in, diabetes is noted as an independent category. Can we clarify if this is type 2 or type 1 diabetes? If type 1 would be an autoimmune disorder or in the diabetes category?
So we did not specify type 1 or type 2.
I'm not sure I've seen that done in a lot of the work. I think it tends to be more just
it seems to be a common category, yeah.
Yeah. Mm-hmm. Okay, good. So again, if you have a question or a comment, please continue to drop those into the Q&A. Let's turn now. I think, Sera-Leigh, you've got some thoughts you want to share or ask of Tammy and her experience.
Yeah, so what I wanted to do, Tammy, after presenting all of this data, which we got from a sample of 1,000 women, I wanted to understand your experience living this every day as the director of benefits. How do you make sure that the women's health benefits really connect with the needs of your team, and especially in the type of retail environment that you have?
I always rely on data for initially to be able to see if I identify trends that are really jumping out in the data. I'd say I'll give an example of that. Like right now, we're going to be introducing cryopreservation benefits on January 1st, and it became very obvious to me because we've got over 85% of our population falling into moderate to high risk, in regards to pregnancies, and it's all coming back to that age factor. So when I see things like that, that definitely serves as a catalyst for me for benefit programming. But I would say probably the most important piece of it is really engaging, with the women in the organization. We need to have an open door, and I solicit personal feedback. I try to get involved in resource groups so that it's a comfortable setting, so they know I'm there to help and I want to understand. I think that's probably, that's served me very well throughout the years. And then as we bring things to life and add them to the benefit programs, I'm generally very careful about circling that back to the groups that made it happen, so
Right.
that they understand that they really had an impact in the decision-making process, and that we don't know what we don't know. I can't tell you how many times I've said that to groups where it's just, I need them
Mhm.
to be vocal and to tell me, what's happening and where the obstacles and barriers are, and help me to, solution for that. I literally yesterday when I drove up here, we had our mobile mammogram sitting
Right.
outside. So, it's like things like that have happened here for years, definitely prior to me. And, I think, that type of feedback from people in regards to breaking down barriers and bringing things to them is a very, very big part of the solution, and making sure that we have the utilization that we're hoping to get.
Right. And that kind of leads to my next question on what's worked for you in getting, and we're talking about women's benefits here. So I'm interested in your female employee population. What worked for you in getting them to not just know about them, but like really actually use the benefits that you offer?
To actually engage. It is probably the biggest challenge that we have out there. And I'm not going to say it's an easy, there's no one fixed solution. I mean, the populations I've worked with and for the past 20 years have all been disparate and geographically challenged and have always been a mix of like 4 generations. So it's, I'm lucky that I've been able to kind of stay in this space and try to get to know each of the populations. I think, for instance, like if you have distribution centers or manufacturing plants where you have captive audiences, or even, corporate support centers or customer service centers, it's so important to still be live, to
Well,
engage,
it's
face
true.
to face. It makes a
Yeah.
huge difference. Yeah. And I think throughout the pandemic, many stopped doing it and,
Mhm.
haven't really started engaging in that process again. But I think they need to know what's out there, and they need to know, how they can engage in a very simple way. I'd say some of the things we're working on in regards to that too is like really trying to take it away from just being in a benefit guide. Giving, very, like you were talking about, like really boiling it down to what are the benefits that are around family building? What are the benefits that are
Right.
specific to women's health? So that they
Mhm.
don't have to seek them out. They know where to go. They've got, the materials, kind of
Yeah.
putting things in their hands in an easier fashion, especially with our stores. They have to have an easy way to access information.
Of course. Yeah, absolutely. So you mentioned like, having all of the generations in the workforce, which we've seen in the last couple of years, that'd be a big concern because you're dealing with like 4 different generations, age-wise, from boomers down to Gen Z. How does that work for you when you implement digital solutions? Have you seen that making a big difference? What's the feedback from, different groups?
In my past, I definitely have seen millennials hook on to things quicker.
Mhm.
So for sure, I think Gen Z seems to be a little bit more skeptical from what I've seen. I don't know if they're like overloaded with apps. They don't, they're definitely a little bit more adverse. And Gen X, my generation, seems to be more and more adaptable and open to to jumping into that space. And it seems like once they get into it, then they don't want to do anything else. So they don't want anything, like to have to breathe that's really long. Now they want a short video or something along
Right.
that line, because they're finding they can get to the core of what they need much quicker.
Quicker.
So
Mhm.
yeah, but I would say definitely the boomers and traditionalists, and I mean they're not out of this. They definitely some of them
Yeah.
are really engaged in technology, but
Mhm.
those who aren't, I think it's important that we're giving those populations or people that don't really embrace technology in the way that a lot of our population does. I think it's very important that you still have resources for them.
Absolutely. Yeah.
Hey, Tammy,
Um,
a question came in the Q&A. Tammy, how do you support the global workforce that may not have access to a U.S. benefit?
Well, in my current role, I don't. Dick's Sporting Goods is only a US based company. So I don't do that. My prior life, when I was with American Eagle Outfitters for quite some time, I worked with, the leaders in those countries, especially very closely with Canada. There were a lot of things that we could do that were quite similar for the Canadian populations, and working with vendors. Finding the vendors was probably the biggest challenge when it came to expanding out to Canada. But I can say the other countries, it seemed to be more difficult. It wasn't as customary to have these types of benefits in their benefit plans. And especially if you're, working with a consultant that's 100% employer paid, it just didn't seem to be prioritized the way that we were prioritizing it in the United States. So really having active discussions with consultants and those who had their boots on the ground to make sure that, things were prioritized, and things even like parental leave. It was like an afterthought in a lot of cases. So to bring those things forward and try to have more of a globally equitable programming strategy it takes effort for sure.
Good, thank you.
Yeah.
Okay, Sera-Leigh, that was the end of the questions coming in on the Q&A.
Yeah. Tammy, I wanted to know, because part of our data really looked at the impact of benefits, what outcomes using or having those tailored women's health benefits really bring about. And have you seen, or can you share how having such tailored benefits contributed to improving retention or even reducing absence or boosting productivity in your organization?
So I can say, because a lot of these things I'm introducing as of January 1st in this population. So I'll be watching those very closely to see how they impact retention, because I have seen it in my past for sure. And I've seen the reduction also from even like a claims perspective, when you're talking about reproductive health and, things like fertility assistance, and opening up, not putting financial limitations or barriers around access, tends to give people a comfort level that they can get the tests, that they traditionally would not have because they were too expensive, which did result in definitely better outcomes, lower, neonatal claims, better outcomes from like even having a successful pregnancy standpoint.
Mm-hmm.
With other benefits I've implemented in the past, I definitely have seen the retention factor when people are, coming back to work. Because I mean, a lot of women do have to make that hard decision, to not re-enter the workforce.
Yep.
And, I think if we can structure the benefits in a way that gives them a support system, as well as the return to work benefits and flexibility that they need to do so in a way that won't cause more mental and behavioral health stress,
Mm-hmm.
or, things along that line, then that's also helped a lot. I think a couple of the, other pieces that I actively look at in any benefit program designing is things like disability leaves. It's historically, disability leaves have been structured to really, I think, really support people that are higher income levels more than they do lower income levels. So I do think it's, from my standpoint, when you level that playing field and you give people the time that they need when they need it, and like if women are having to go out, whether it's mental health related or family building or or what have you, I think they need the time, especially given the context around the fact that most women are the number one caregivers in this country. So there's usually more to tackle than just their own health at that point.
Mm-hmm.
So,
Tammy, you mentioned that Dick's is in most of the states across the U.S. So, what are your thoughts on a lot of the paid family leave laws that have popped up over the last few years, and the consistency, the equity, and then how it fits into your leave and disability program? Because I have to imagine with all the employees in all the states, you've got your hands full.
It's a beast. I'm not gonna lie, Jim, it's a beast. And I would venture to say probably every employer feels this way. Paid family medical leave, that new ones are coming out all of the time. We're working on, we've got Delaware, Maine. It's just never ending animal, it seems. And we're trying to understand how, I think a lot of us are really trying to understand, how do you structure something, to your point, so that it is equitable across the country? Because, states, I think, are using this as a tool of, to attract people to work in their states. But it does make it very difficult when you've got, locations spread across in almost every state, to say, well, sure, you have, either paid sick leave or you have paid FML, but you don't have it, across, the border into another state. So there's a lot of, I think it's a 50-50 split, that employers are either using a PTO strategy, with vacation and sick time combined, versus, having them separated into vacation and paid sick time. I think that's another one of the challenges, is trying to figure out what will work best. And there's pros and cons of both. But there's a lot of financial considerations to be made in that space too. But from an equity standpoint, it's actually on my to-do list for next year, is to explore that deeply, to try to figure out what the best strategy is forward. But yeah, there's a lot to consider.
It's a beast, right? That's the best.
Yes.
We had a question come in. How do you control cost for the employer?
I think with anything, I mean, there's a give and take, right? You have to invest in your people. And I think it really does boil down to, I mean, some of these programs, like I was saying to, Sera-Leigh earlier, I've seen the impact from a financial standpoint in medical claims. I've seen, better outcomes. But you also, you have those intrinsic types of, things that come from people just being happier, and being more engaged and valuing their employer, because they're seeing things happen in there that really fosters a culture of caring, and, and making sure that voices are heard. So retention is, I think it's a big deal, and engagement's huge. If people aren't engaged, they're not productive. And if they're not, if they don't have the resources that they need, then, you're not going to have the healthiest organization. And I'm a big believer in organizational health. The stronger your organization is from a health perspective, it's going to perform better overall.
Yeah, and I think, Tammy, it's a good way to look at it, because if you have strong retention, strong satisfaction, then you can offset turnover costs, which it's very costly when you get into heavy turnover, to hire new employees, onboarding. So it's a kind of a give and take, like you say, right? You give into taking care of your people, and then they stay, and you don't have to give into turnover costs. So it's a cycle. Yeah.
Absolutely.
So where do you see women's health benefits headed in the next few years, and how is DICS preparing for what's coming?
I think there's a lot going on right now. And I do want to say one quick thing about like structure too. And I'm going to go back to the disability insurance real quick. Just so, for instance, say with like short-term disability, a lot of employers offer short-term disability benefits on a taxable basis. I'd encourage you to talk to your brokers and consultants about structuring it as a tax-free benefit, to try and see if that might be a very kind of financially neutral way to provide a bigger benefit to your people. So just want to make sure I said that out loud. So some of the things that I'm looking at ahead, we are going to be introducing things like pelvic floor exercises and menopause benefits in the new year. We're leaning in more on postpartum benefits as well. From a prevention standpoint, and I'm sure some of the folks on this call have heard about this too, but I'm leaning in heavily to the breast cancer research, especially around the women that have the dense tissue that have been needing to get MRIs and ultrasounds. A lot of them have to get MRIs or ultrasounds, every 6 months, well, on a 6-month cadence compared to the mammogram. So it's like at 6 months you get the MRI, then the next 6 months you get the mammogram, the next 6 months you get another MRI. And in the past, that wasn't considered to be preventive, but it looks like it's moving in that direction, even for high deductibles to have without hitting their deductible. So I think that's super important to lean into, to make sure that we're removing that cost barrier, because that can truly keep somebody from being able to detect if they have breast cancer. Some of the other things that I'm looking at, I mean, I talked about the cryopreservation benefits. I think, the cost to do that far outweigh, it's far is much further below what you would have in a high risk maternity claim. And giving people options, I think is just, it's very important. I'm also leaning into doulas, and we're introducing that in January as well. So I think that's, doulas have been proven to reduce, maternal and infant mortality and improve the outcomes for both moms and babies. So especially when you're talking about marginalized communities, specifically Black communities, it's very important, I think, that we lean into that space and leverage science. I mean, it's been proven. It's the only thing in white papers that seems to work. So I think that's a big one for us. And then lastly, I would just say, I think, looking ahead, when, I want maximize the utilization of all of these programs. So it is the packaging and being able to, work with our teammate resource groups to be able to understand what's resonating and what isn't, and just continuing to iterate on our communication style and strategy.
Absolutely. You just finished open enrollment, and we were chatting before the webinar started on the engagement you got from that, and tell us a little bit about what you think worked really well.
So we went back into our DCs. I call this like face-to-face combat, right? So really putting yourself out there. I had, I think 15 education sessions in 1 week at our corporate support center on a myriad of topics, just really trying to lean in on what I think people think is confusing and offering some, some opportunities to learn. So for instance, like doing a FSA, HRA, HSA, what are the differences type of thing, or, really breaking down, what medical insurance is. People don't know. They do not know. Absolutely. And just, getting into like, the components of what that is and giving examples and making it interactive so people can really walk away with a new skill set that they didn't have before. Videoing everything. I think that's a big thing for us. We have QR codes for every educational video that we've put together, so that people can, grab them off a digital screen or what have you, and just see it at their own convenience. I think that's worked really well, as, just really finding the moments where we can really engage.
And I think that's particularly important with the addition of these very granular benefits that you talked about, targeting women in the upcoming year, the doulas, that kind of thing, because it's probably like drill down on their certain benefits that they might miss if they're not educated about it, or if they're not really actively seeking it out, but need it. It's education that really will get them to use those benefits that they probably want and need and don't know that they have.
Well, and I think it's important. It's not just open enrollment. Like you said, we just finished open enrollment on November 18th, and on December 6th, I'm going to be meeting with Mom Squad and our Women's Influential Network to talk about all of the new benefits that we're rolling out that are related to family building and women's health. So I think it is just really, like finding who your audience is. And I'm going to be tasking them with saying, spread the word. Let's partner together to get this out there, because, we, like Jim, you were saying, I've got, stores all over the country. And I need to make sure that the information is disseminated in a productive way.
And I imagine you have a pretty significant new hire group coming in frequently, right? New
Yes.
teammates joining. That is a great opportunity to engage them, raise their awareness, and get them into the right programs if appropriate. But that always seems to be, if people focus on enrollment, that's the one big event a year where people do pay attention, but new hires are another group.
Right. No, you're absolutely right. Yeah, we have to refresh orientation materials every year and new store opening materials, everything to make sure that, we're staying up with everything and sharing what's relevant, but also a consistent message. I think that's probably the most important piece to me, because if you just put it in the hands of operations, who really, this should not be their job to communicate benefit programs, you give them the tools and they'll use them.
Right.
Yeah.
Tammy, we had a question come in. Do any of your vendor partners offer virtual support groups?
One is looking at it. I can't say who it is because I'm on their client advisory board, but there is one vendor that we've had active discussions with around that. And I think it's around it, very specific needs. I'll just say it's related to substance use management, which I think could be very beneficial.
Is it something you'd like to see more of with your vendor partners, or is it really in that substance category?
No, I think it's an interesting concept. I think that it definitely has been proven that peer-to-peer works. And I think there's populations that are comfortable in that space and those that aren't. I think it's just offering up a different modality for people who, may need that type of support over doing something individually.
Mm-hmm.
Mm-hmm.
Okay, Sera-Leigh, that's it for inbound questions.
Yeah, and Tammy, you've answered all of my questions. Was there anything else that jumped out at you in the data, or anything in your experience with women's health benefits that we didn't touch on that you wanted to mention?
Looking at my notes here, I guess the only thing I would say to wrap up is just I would encourage anyone that's listening to this to just be really intentional around what you're doing in this space. And, make sure you're promoting your people to be vocal and talk and share and take their feedback. And evolving the programs is something that's never going to stop. So don't get comfortable.
Well, I really appreciate your time and expertise here. It seems like you're leading the way, and Dix is doing the right thing in women's health benefits and really pioneering a lot of stuff. So I hope it goes really well next year when you introduce all of these benefits.
No, thank you. Thanks. Yep, we're looking forward to it.
Well, thank you both. This has been a great conversation. Sera-Leigh, thank you for kind of distilling and synthesizing what I know was just a lot of information and data that you looked at. And Tammy, thank you for sharing your perspectives. You're in the heat of enrollment and wrapping up, and you've got a lot going on at Dix. Thank you for sharing and spending some time with us. And congratulations again on all the work that you're doing on behalf of the organization and your teammates. Thank you to everyone who's joined the webinar today. As a reminder, we'll be distributing a recording of the session as well as Sarah's slides, and look for our next webinar coming up shortly. Thank you all again and have a good day.
Thank you.